Piles or hemorrhoids are basically swollen tissue in the rectum or on the anus. The cause of the swollen tissue is blood vessels engorged with blood under the tissue. We do not fully understand why this occurs, but it is far more common than most people think. A number of factors are thought to cause piles, from lifestyle, age, diet and genetics. Some people are more prone to the condition. Some people will have hemorrhoids but have no symptoms. Some will report pain or bleeding when they go to the toilet. So how can you treat or even cure piles? This video will point out the 2 steps for a natural cure for piles. In most cases, the severity of the piles will influence how easy it is to treat and ultimately cure the condition. Highly advanced hemorrhoid that have become prolapsed will require surgery. They will take time to heal and may reoccur. Milder forms of the problem will be easier to treat and ultimately stop from reoccurring. So a pre-step to curing piles is to get a proper diagnosis of the problem. Assuming that your piles are mild, there are 2 steps. The first is to stop the initial problem and the second is to put in place a plan to stop it coming back. Dealing with the initial problem naturally can involve all sorts of remedies. There are many simple things you can do, from applying crushed ice to the site of the piles. Alternatively, bathing it in a warm bath may also help. This will relieve typical symptoms and may even cause the swelling to go down to some extent. After that, you need to take some form of astringent that will work at reducing the swelling. There are many naturally occurring astringents and many pharmaceutical formulations also use astringents as the active agent. The overall aim is to cause the swelling to go down or shrink back into the tissue so that it does not get irritated. Whilst you are doing this, you should also be changing your diet and some lifestyle issues. Constipation is thought to be the leading cause of piles and also an irritant to the condition. Ensuring that you do not have constipation is ultimately the cure to hemorrhoids. Other factors can also influence your chances. Getting exercise is one, and toiletry habits is another. As yet there is no traditional cure, whereby you have an injection or take a pill and your hemorrhoids problems are over. It's not that kind of condition. Essentially, all you can do is prevent it from coming back. But this can be effective. With this said, here is more detail on the 2-step plan. The first objective is to heal the flare-up. If it is the first time you have had piles, then you should really see your doctor to get an accurate diagnosis. It could be something else. However, people that have had the problem before have 3 options, well 4 if you put them all together. You can protect the site of the piles flare-up with a cream. So even though the piles still exist, you should not feel the symptoms. You could apply an astringent, in the form of a topical cream or even an oral supplement. This will shrink the swelling, thus effectively healing the condition. And you can take a stool softener that ensures that hard feces does not rub against the swollen tissue. Or better still, do all of the above. This should heal any flare-ups, but ultimately preventing them coming back comes down to a few things. Primarily, you should avoid getting constipation. Or if you are a constant sufferer of this problem, then work on it. Simple things like going to the toilet when you get the urge, not holding it in, can prevent constipation. Avoiding stress, especially chronic stress, can also help avoid constipation. Eating more fiber is a much quoted option, but it really does work. Don't spend a long time on the toilet, reading books or a magazine. Don't strain when on the toilet.